So the next topic to understand over here is the scapular anastomosis, that is the anastomosis of arteries around the scapula. Anastomosis of basically the arteries around the scapula. Now understand the arterial tree in the upper limb. The main artery that supplies our upper limb is our axillary artery, that continues into the brachial artery, and that continues into the radial ulnar artery. But from where does the axillary artery actually starts? The axillary artery actually starts from it is a continuation of the subclavian artery. So to understand the scapular anastomosis, we have to understand the subclavian artery also a little bit. Supposedly this is our first rib. This is our first rib. In the first rib, we have a tubercle that is known as scalene tubercle. That tubercle is known as scalene tubercle. And over the scalene tubercle, the muscle that is attached in the scalene tubercle is our scalenus anterior. Muscle that is attached on the scalene tubercle is scalenus anterior. Now what is happening is, if you remember the aorta coming from the left ventricle of the heart, aorta, then we have the arch of aorta. Then from the arch of aorta we have the brachiocephalic on the right side. Brachiocephalic divides into right subclavian and common carotid. After that we have the left common carotid and left subclavian. So what is happening actually is, supposedly this is our aorta, brachiocephalic, right subclavian, right common carotid. Then we have left common carotid and left subclavian. The subclavian vessel on both the sides, they are actually going to supply our thoracic region, anterior chest wall, and the upper limb including the axilla. While this common carotid is going to supply our brain, head, neck and face part. So this goes up where into around the carotid sheath, going to in the neck region, and it will divide into internal carotid, into the brain, external carotid for our face and head region, neck region. While the subclavian is a point of interest over here. So this subclavian artery on both the right as well as the left side, they will move laterally and they will make a loop around this first rib. So this is supposedly the subclavian artery, and it is making a loop around the first rib. First rib, we have the scalene tubercle over which the scalenus anterior muscle is attached, and this is our subclavian artery. Remember, the scalenus anterior muscle is lying in front of this subclavian artery. So subclavian artery is actually behind the scalenus anterior muscle. What lies in front of scalenus anterior muscle is the subclavian vein. This is the vein part, the subclavian vein, and this is our subclavian artery. So subclavian artery lies behind the scalenus anterior muscle. Subclavian vein is lying anteriorly and below the scalenus anterior muscle. So the point to note over here is, this is the first rib, and this line over here is the outer border of first rib. Subclavian artery is from its origin, from where it takes origin, either from the arch or the brachiocephalic, up till the outer border of first rib. Once this artery crosses this outer border of first rib, we call it axillary artery, because it is now technically inside the axilla region of our upper limb. So from here to here we have the subclavian artery, and from here onwards we have the axillary artery. Now remember, this axillary artery will supply in the axilla and at the lower border of teres major. At which part? At the lower border of which muscle? Teres major. As soon as this artery crosses the lower border of teres major, then is the time when we call it brachial artery. Brachial artery. So the artery is the same. It is a big artery. Only the name changes according to its location. When it is inside the first rib, below the clavicle, we call it subclavian artery, below the clavicle. As soon as it crosses the outer border of first rib, we call it axillary artery. inside this axilla part. Then as soon as it crosses the teres major, lower border of teres major, we will call it brachial artery. Why brachial? Brachium means arm. So it has reached, technically it has reached the arm part. So now we call it the brachial artery. So subclavian, axillary and brachial artery. Now this scalene anterior muscle divides this subclavian artery into three parts. The first part is lying medial to the muscle. Second part of this artery is lying behind this muscle. And third part of this artery is lying lateral or outside to this scalenus anterior muscle. So this whole subclavian artery from here to here is divided into three parts by the scalenus anterior muscle. While there is another muscle over here, that is our pectoralis minor. Another muscle over here in the axilla, which we already studied while doing the clavipectoral fascia. This pectoralis minor divides this axillary artery into again three parts. First part, second part behind the artery, and third part below this muscle. First part between the outer border of first rib and the pectoralis minor. Second part of axillary artery is behind this pectoralis minor muscle, and third part is from this pectoralis minor up till the lower border of teres major. So this is the axillary region, this is the subclavian region. And then we have the brachial artery. Now the point to note over here is the subscapular anastomosis. The anastomosis around the scapula. So where is scapula? Scapula is lying on the posterior aspect of which area? Obviously our pectoral region, posterior side of pectoral region, we have the scapula. So the location of scapula is somewhat over here. Now what happens over here is, understand this point, is that supposedly due to any reason, and there are many reasons, the most common one being the cervical rib. Due to any reason, there is a constriction at any of this level. There is a arterial constriction, or the artery is being compressed due to any reason around this whole area. Then what happens is that the blood won't be able to reach the upper limb, and the whole upper limb may get necrosed. So what happens is that few branches from the first part of subclavian artery will anastomose with a few branches of the third part of axillary artery. I will repeat again, few branches from the first part of subclavian artery will anastomose with a few branches from the third part of axillary artery, where around scapula, during which situations? During any constriction or any compression over this entire vessels. Why? To maintain the supply, arterial supply to the upper limb. So this anastomosis between first part of subclavian and the third part of axillary artery, around which bone? Around scapula, is actually our scapular anastomosis. Around scapula is actually our scapular anastomosis. To understand this, we need to know the branches of the subclavian as well as the axillary artery. So let's see the branches of subclavian and the axillary artery. So the branch, first of all, let's start with the branches of subclavian artery. So subclavian artery has three parts, as you already know by now. First part, second part, third part. From the first part of subclavian artery, the mnemonic branches are VIT. V is for the vertebral artery. I is for the internal thoracic artery. T is for the thyro-scapulo-cervical trunk. Why? Because it will again divide into other few branches, so we call it trunk. Now understand the fate over here of these branches, because all these have come into the questions. This vertebral artery will go where? Into the upper 6 cervical vertebrae, foramen transversarium, not in the foramen transversarium of C7. Another question frequently asked. Internal thoracic artery, as the name is suggesting, it will go to the thorax region. Internal thoracic, also known as internal mammary artery. Internal mammary artery. So it will go and supply the mammary glands or the anterior pectoral region. Thyro-scapulo-cervical trunk. So we have the three names over here. Thyro-scapulo-cervical trunk. Thyro, obviously related to thyroid. The thyroid is situated superior to the subclavian artery. Subclavian artery is over here, thyroid is over here. So the artery coming from subclavian to the thyroid will be inferior thyroid. So artery over here will be the inferior thyroid artery. Scapulo, it is over the scapula, so the branch over here will be from the scapula we have suprascapular artery. Cervical here is our transverse cervical artery. Transverse cervical artery. So thyro-scapulo-cervical trunk, thyro-inferior thyroid artery, scapulo-suprascapular artery, cervical transverse cervical artery. From the transverse cervical artery arises our superficial cervical, or sometimes we have another artery coming directly from the transverse cervical, sometimes a dorsal scapular artery. Dorsal scapular artery. Remember these branches of the vertebral subclavian artery first part. Only the first part, we only dealt with the first part. Now coming to the second part, the branches from the second part of subclavian artery. The second part of subclavian artery gives off just one branch, that is our costo-cervical trunk. Again trunk, this costo is superior intercostal artery, and the cervical over here is the deep cervical artery. Deep cervical artery. While from the third part of subclavian artery, we only have one branch, and also that branch only when that branch is not coming from the transverse cervical, that is our dorsal scapular. So dorsal scapular can either arise from the third part of subclavian artery, and if it is not arising from here, then it will arise from the transverse cervical artery, which is actually a branch from the first part of subclavian artery. So these are the branches of subclavian artery. Remember, we are doing this topic is scapular anastomosis. So basically the anastomosis was between the branches from the first part of subclavian artery. So out of these first part, the main branches that participate in the scapular anastomosis, one is our suprascapular, and then we have the transverse cervical, out of which the branch dorsal scapular, if it is not arising separately from the third part. These are the branches coming from the first part of subclavian, which will take part in the scapular anastomosis. Moving on from here, if we look at the axillary artery, then axillary artery, remember, another one-liner, single-liner questions. Axillary artery was actually being divided by which muscle? It was being divided by the pectoralis minor muscle into three parts again. Was divided by which muscle? Was divided by pectoralis minor muscle into three parts, first, second and third. The first part of axillary artery, which will be located between the outer border of first rib and the upper margin or the medial margin of pectoralis minor, the branch that comes is our superior thoracic artery. Superior thoracic artery. The branch from the second part of axillary artery, which is lying actually behind the P minor or pectoralis minor, are basically two. Those are thoracoacromial artery or acromiothoracic artery and lateral thoracic artery. Lateral thoracic artery. While the branches from the third part of axillary artery, which will be located between the P minor and the teres major, the branches coming from the third part are subscapular, then anterior circumflex humeral artery, and obviously posterior circumflex humeral artery. How to remember the names? First, remember how many branches from which part. First part only one branch, second part two branches, third part three branches. 1, 2, 3, 1, 2, 3 number of branches. Now understand the location. First part is lying superiorly in the thoracic region, we call it superior thoracic artery. Second part, we are moving laterally, we call it lateral thoracic artery. Plus it is coming close to acromion, we call it thoracoacromial artery. Then third part, we are moving more inferiorly into the upper limb. We have the subscapular artery. Remember suprascapular artery, again a question. Suprascapular is a branch from the subclavian artery. Subscapular is a branch from the axillary artery. Suprascapular branch from the thyroscapulocervical trunk, that is the first branch from the first part of subclavian. Subscapular artery over here. Then as soon as we are reaching the upper limb, we have the circumflex humeral. Obviously the name suggests this anterior and posterior circumflex humeral, they will encircle the upper end of humerus anteriorly as well as posteriorly. So we call it anterior circumflex humeral and a posterior circumflex humeral artery. Now coming again to the topic, the scapular anastomosis. The point to note over here is what are the branches of the axillary artery which participate in scapular anastomosis. That are the branches of the third part. So which branches of third part? The branches of the third part which participate in scapular anastomosis are this subscapular artery and its branch. It basically gives off two branches. One is circumflex scapular and one is thoracodorsal artery. It is this circumflex scapular artery which participates in the anastomosis around the scapula, scapular anastomosis. So whenever there is any compression or constriction to this vessel, subclavian or axillary, the branches from subscapular artery will anastomose with the branches of subclavian artery, first part, that is suprascapular and transcervical, and they will anastomose around the scapula, and that term is known as pulsating scapula. If the anastomosis is so severe, then it will seem as if the scapula is pulsating. We call it, the term is known as pulsating scapula. Common reasons, we have the cervical rib. The cervical rib, normally the ribs originate or the ribs are attached to the thoracic vertebrae, 12 pair of ribs to the 12 thoracic vertebrae. Sometimes there is an abnormal rib, cervical rib, which arises from the 7 cervical vertebrae, and it forms a band and it inserts over the superior surface of the first rib. So supposedly if this was the first rib, and on this first rib we had the looping of this subclavian artery. Subclavian artery was looping over this first rib. Now supposedly there is a cervical rib, and that cervical rib or this fibrous band, whatever it is, it could be a ligamentous structure, a band structure. Supposedly this is a cervical rib. If the cervical rib coming from the 7th C7, this is attached to T1, first rib to T1, cervical rib from C7. If this band attaches on the superior surface of the first rib, then this subclavian artery will have to loop over this cervical rib. So it has to increase its loop. Therefore, it will obviously get compressed over this cervical rib or fibrous band. That will give rise to this scapular anastomosis, because obviously there will be less blood going into the upper limb. So from here the suprascapular branches will go, and from axillary artery the subscapular, circumflex scapular branches will come and they will anastomose around the scapula. This is the scapular anastomosis, frequently asked in the NEET PG or AIMS JIPMER exams. MCQs. Main MCQs are which of the following pair of arteries participate in the scapular anastomosis. Or they will give you a clinical condition of supposedly cervical rib. The patient is feeling pain and paresthesia and there is decreased pulsation in the upper limb. And they will ask you what are the arteries which are anastomosing around the scapula. So actually the topic over here is scapular anastomosis, and we should know what are the branches that are participating in the scapular anastomosis. Remember the point over here. Few points over here, again single liner questions that may help. Is the superior thoracic artery is supplying obviously the superior part of thorax. This lateral thoracic artery is actually the main supply of mammary gland. It is the main supply of breast or mammary gland. Main supply of breast or mammary gland. Then subscapular artery The subscapular artery is the largest branch of axillary artery is the subscapular artery. Another question out of these, this posterior circumflex humeral artery, this posterior circumflex humeral artery, it travels with the axillary nerve. Around which space? Around the space that is our quadrangular space. That we'll do just in a while. This quadrangular and other spaces. So this posterior circumflex humeral artery travels with axillary nerve in the quadrangular space, and other important points in this branches of axillary and subclavian artery. Now let's do the spaces around the shoulder. The next topic is spaces around shoulder. We have the spaces around the shoulder region. Spaces around shoulder. Now again, humerus. Then we have this shallow glenoid cavity. We have this scapula. Now we are looking at the shoulder region from posteriorly. We are looking at the shoulder region posteriorly. Then what were the main muscles, if we recall? Then from this lateral border of scapula, we have teres minor and teres major. We have teres minor and teres major. Let's start one by one. This teres major, if you recall, this teres major was actually coming from the lower part of lateral border of scapula and is inserting where? It is inserting into the medial lip of bicipital groove, which is located anteriorly. So this teres major coming from the lower part of the lateral border of scapula, and it is inserting into the medial lip of bicipital groove. Now there is another muscle from the infraglenoid tubercle. If we make it as a different red color, then this muscle was a long head of tendon of the long head of triceps. So this will be the long head of triceps. It will go where? It will go into the back of humerus. From there, at the back of humerus, it will merge with the lateral and medial head of triceps, and they all will insert into the ulna, the long head of triceps. Long head of triceps. Now understand over here that this is the long head of triceps. If you just look at it right now, and you will elicit that there is a space over here. There is a triangular space right over here, and this space is actually our triangular space. One triangular space over here. Now there is one other muscle that is left, is our teres minor. So this teres minor is actually, if you make it with a black color, this teres minor is coming from over the teres major, this teres minor muscle, and this teres minor will insert where? It will insert into the lower part of greater tubercle. Remember SIT, supraspinatus, infraspinatus, teres minor. This is the teres minor. This is the teres minor. On the point of insertion, there develops a space. On the point of insertion, there develops a space. So this whole is the teres minor, and there develops a space over here. That is a quadrilateral in shape. If you elevate this teres minor, then there is a space over here. That is our quadrilateral space. quadrilateral space. So here is one quadrangular space or quadrilateral space. Then we have a triangular space over here. Then as we lift this teres minor over teres major, then another space develops over here. This triangular, this is another triangular space. So the spaces around the shoulder region, we have a quadrangular or a quadrilateral space, and we have two triangular spaces. Understand here, the margins of the spaces have been asked. So we have the question about the margins of spaces and what is there in the content or what are the structures inside those spaces. So the structures present in the spaces have been asked. Margins we have to understand is that we are looking at this area from posterior aspect again. Just remember, we can make spine and acromion over here. So moving from anterior to posterior, the main muscles involved in defining these spaces from anterior to posterior are: most anterior we have this teres major going where? Anterior part of humerus, bicipital groove. Then we have the long head of triceps, and more posteriorly, covering long head of triceps posteriorly, we have the teres minor. So anterior to posterior, the muscles are teres major, then we have long head of triceps, and then we have teres minor. Moving from anterior to posterior. So supposedly the question comes of this quadrangular or the quadrilateral space. The boundaries are the lower margin of the teres minor, this one. Then we have the long head of triceps. Then we have the teres major, and then we have the humerus. These form the margins of the quadrangulars. Same for the triangular, both these triangular spaces. This triangular space, you can make it with a different color, this triangular space. Now the contents of these spaces, that is important. In this quadrangular or quadrilateral space, what runs is, as it is close to the surgical neck of humerus. Remember, there are two necks: anatomical neck and the surgical neck. So in this quadrangular or quadrilateral space, the contents are our axillary nerve and posterior circumflex humeral artery or vessel. The contents of the quadrangular or quadrilateral space. This triangular space over here, which is close to the medial border of humerus. On the posterior, if you remember the humerus, we have the radial or spiral groove. So what lies in this radial or spiral groove? The name radial groove, we have the radial nerve and we have the profunda brachii vessel. So these two structures actually pass through this triangular space and go into the radial or spiral groove. So in this triangular space we have the radial nerve and profunda brachii vessel. Profunda brachii vessel. While coming to this triangular space, the content over here is the branch of subscapular artery which was participating in the scapular anastomosis, and that was our circumflex scapular artery. Circumflex scapular artery. So these are the spaces and these are the boundaries, these are the contents. Question normally comes from this topic, the spaces around the shoulder region. Now moving on from this topic on spaces around the shoulder, let's see few points of the shoulder joint. Shoulder joint